Hello everyone, I am Diya Titya in third year B Physiotherapy from Marwad University. Today my topic is Nasogastric tube, NG tube, uses and care department of surgery. So hello everyone, I am Diya Titya in third year B Physiotherapy from Marwad University. Today my topic is Nasogastric tube, NG tubes, uses and care department of surgery. So let's start it. First of all, we are understanding about introduction. A nasogastric tube is a flexible tube passed through the nose, esophagus and stomach. First of all, we are understanding about introduction. A nasogastric tube is flexible tube passed through the nose, esophagus and stomach. Commonly used in surgical and medical patient, helps in decompression, feeding, medication and diagnosis. These are the pictures of nasogastric tube is inserted into the nose, through the esophagus, through the stomach. Then indications of NG tube: gastrointestinal decompression, enteral feeding, administration of drugs, gastric lavage, diagnosis purpose. Uses of nasogastric tube in surgical uses. First is gastric decompression. In gastric decompression, relieves gastric distension, used in intestinal obstruction, paralytic ileusis, post-operative patients. Then second one is prevention of aspiration, removes gastric contents, reduce risk during emergency surgery, intestinal obstruction. Then third one is enteral feeding for patients unable to swallow, used in stroke, head injury and post-operative patients. Then fourth is drug administration. Medicines give when oral intake is not possible. Then diagnostic uses: aspiration of gastric content for bleeding, poisoning and test for upper GI bleeding and gastric outlet obstruction. Then care of nasogastric tube. Pre-insertion care is first care. In pre-insertion care, explain procedure to patient, check nasal patency and measure tube length, nose, ear and xiphoid. Then lubricates tube. Second is care during insertion. Position of patient in high flow position, encourage swallowing, observe for coughing, cyanosis and respiratory disease. Post-insertion care is confirm placement, aspirate gastric contents, pH testing, X-ray confirmation is gold standard and secure tube properly, content to feeding or suction are prescribed. You are able to show the images for post-insertion of NG tubes and taken care about it. Daily nursing care is check tube position daily, maintain oral and nasal hygiene, flush tube with water and record intake and output, nature of aspire. Complications of NG tube is nasal ulceration, esophagitis, aspiration pneumonia, tube blockage, electrolyte imbalance. Then removal of NG tube. Explain procedure of the removal of the NG tube to the patient by the therapist or doctor. Then clamp tube. Ask patient to hold breath. Remove gently and steadily. Provide oral care. I hope you are understanding my topic. Thank you.